Managing chronic pain requires delivering high analgesic concentrations directly to damaged tissue, while avoiding the systemic gastrointestinal and renal toxicity common with oral medications. Topical analgesics are designed to solve this problem by providing localized relief with minimal systemic absorption. These peripheral therapies originated as empirical, plant-derived remedies, long before their molecular mechanisms were mapped in a laboratory. We now identify the specific molecular targets of these phytochemicals as transient receptor potential, or TRP, channels situated on peripheral nerve terminals. Achieving clinical efficacy depends on the precise molecular-level manipulation of these specific nociceptors. TRPV1 is the specific heat and pain receptor triggered by the application of capsaicin, the pungent compound found in chili peppers. Conversely, TRPM8 acts as the opposing cold receptor, specifically triggered by the application of menthol. For decades, pharmacological laws assumed these two receptors functioned as isolated, independent biological switches. However, modern electrophysiological data suggest these pathways are functionally entangled, engaging in active reciprocal neuromodulation. Treating these receptors as separate switches overlooks the underlying biophysics that govern their interaction. To measure these channel currents simultaneously, researchers utilized patch clamp electrophysiology. This graph maps the current voltage relationship, showing the spike in TRPV1-mediated currents when capsaicin is introduced. But adding menthol actively drives down those capsaicin-evoked currents dose-dependently. Conversely, introducing capsaicin similarly inhibits the menthol-evoked TRPM8 currents. Mutagenesis analysis confirms these compounds do not compete for the exact same binding pocket on their receptors. Instead, this interaction operates as a form of allosteric cross-inhibition. By inhibiting the opposing receptor's activity, this cross-inhibition turns sensory irritation into a pharmacologically modifiable variable. This interaction translates from isolated in vitro cells to human sensory responses in vivo. Researchers use vinyl butyl ether, or VBE, a structural analog of capsaicin that robustly activates TRPV1, causing significant sensory irritation. This line chart tracks escalating sensory irritation scores reported by human subjects over a 10-minute application period. When 0.3% menthol is applied concurrently with the VBE, those irritation scores decrease significantly. In a clinical setting, menthol acts as a localized TRPV1 antagonist. The cross-modulation of these receptors effectively dampens acute nociceptive firing. Beyond the peripheral nerve terminals, this crosstalk also influences the local immune system, specifically in macrophage shells. In laboratory models, cellular inflammation is induced by exposing these macrophage cultures to lipopolysaccharide. This bar chart tracks the release of the cytokine TNF-alpha. Applying capsaicin alone yields a moderate reduction, but when capsaicin and menthol are combined, the TNF-alpha concentration drops several hundredfold compared to individual applications. This suppression occurs because the compounds activate parallel intracellular pathways. Menthol utilizes TRP-dependent calcium signaling to modulate the cell, while capsaicin utilizes a separate TRP-independent intracellular pathway to suppress inflammation. The simultaneous activation of these separate immune pathways yields a disease-modifying anti-inflammatory synergy. This precision also applies to high-dose capsaicin therapies, such as the 8% patch approved for post-herpetic neuralgia. Low-dose capsaicin applications result in a simple, temporary exhaustion of the receptor. This mild receptor exhaustion is known as tachyphylaxis. An 8% high-dose application forces the TRPV1 channel open, triggering a massive, sustained influx of calcium into the intracellular space. This calcium overload initiates a targeted breakdown of the internal microtubule and cytoskeletal structure of the nerve terminal. This structural pruning process is defined as nerve terminal defunctionalization. While it produces severe initial burning, this defunctionalization process physically halts signal transmission, providing neuropathic pain relief for roughly 24 weeks until the nerve fibers slowly regrow. Integrating these electrophysiological and immunological mechanisms yields a comprehensive model of topical pain management. First, TRPM8 and TRPV1 cross-inhibition actively dampens acute sensory irritation at the receptor level. Second, parallel intracellular pathways create massive exponential immune suppression in the local macrophages. Third, high-dose calcium overload executes long-term defunctionalization of nerve terminals to arrest severe neuropathic pain. All three of these precise biological functions occur simultaneously within the treated tissue area. These localized cellular mechanisms directly dictate clinical metrics, establishing the required number needed to treat to achieve patient relief. Achieving clinical efficacy relies on triggering this multicellular cascade. These agents function as sophisticated modulators of the peripheral nervous system. Historical descriptions of topical creams as counter-irritants are functionally obsolete. The next generation of pain medicine relies on exploiting the precise receptor biophysics and synergistic interactions of these plant-derived compounds. The therapeutic goal is to engineer synergistic topical formulations capable of targeting distinct neuropathic and inflammatory pain profiles at the source. This localized precision stands in contrast to the high-risk reliance on systemic medications, which carry severe toxicity profiles and widespread off-target effects. By decoding the molecular synergy of topical analgesics, pain specialists can achieve localized relief that alters the risk-benefit ratio in chronic pain management.